everybody. We were just talking a little bit here on campus before about how great it is to be back, isn't it? So it's probably good that we're still talking about psychological disorders this week too, right? Because maybe we can start to diagnose some of us since we had to come back. So 2 weeks, right? We have 2 weeks of class and then finals, and then it's done. So you only have to endure like 3 more weeks, right? So I think we'll make it. So we have the pleasure this morning of actually having another student come and take the first part of the lecture today, Colton, who is actually in one of my other classes as well, and comes to the research meeting that I've talked a little bit about before. And so he's going to get the ball rolling with a little bit of information on schizophrenia, which is actually kind of a fascinating disorder. And then since we only have today and Wednesday to finish up disorders, entertaining questions about any of the disorders, or we can jump in and talk a little bit more about schizophrenia or whichever ones you want, and probably do personality disorders maybe on Wednesdays. So without further ado,
thank you guys for having me today. So I'm going to talk about schizophrenia. Schizophrenia is really, like Dr. John said, it's a fascinating disorder. There's a lot of interesting symptoms that go along with schizophrenia. Schizophrenia is not very common. Only, I think it's less than 1% of the people in the entire population of America that have schizophrenia. So it's really uncommon. The word schizophrenia, if you split it into its 2 parts, schizo and phrenia, it means literally a splitting of the mind. Does anyone know why it might be called a splitting of the mind? Yeah, go ahead.
Because you have a hard time determining what is real and what's not real, and what's imaginary and what's like real life. It kind of meshes together, and so one side of your brain maybe is real life, and the other side is your fantasy, and that's why it's I don't know.
No, that's actually perfect. It's a perfect answer. They say it's like a splitting of the mind from reality. So that's exactly what you said. It's a splitting of the mind from reality. A lot of the symptoms that come along with schizophrenia are symptoms that make it so it's hard for the person that has it to discern what's real and what's not. So we're going to talk about the symptoms of schizophrenia, and those symptoms are split kind of into 2 categories, which are positive symptoms and negative symptoms. Positive symptoms and negative symptoms aren't like, it's like a positive symptom is one that you want to have, like it's a good one, and the negative one's like bad and you don't want to have it. It's more like positive symptoms are things that add to their behavior, or it adds like an abnormal thought or feeling or action to them. And a negative one is something that takes away from their behavior. So positive adds and negative takes away. And we'll watch just a short video about that really quick.
Hattie's family knows there's something wrong with her. They bring her to a psychologist with complaints about her behavior. She says she hears voices that she believes are real, and she believes that God has chosen her to bring justice on the world for the sins she sees around her. In addition, she speaks in a monotone voice and shows very little emotion. She doesn't seem motivated to make friends or do any of the things that normal 19-year-olds do. She doesn't take care of herself, and someone has to stand beside her to make her brush her teeth or take a shower. Hattie's psychologist listens to Hattie's family and to Hattie herself describe her symptoms, and then makes a diagnosis of schizophrenia. Schizophrenia is a psychotic disorder that is associated with many symptoms, including hallucinations and delusions. The symptoms of schizophrenia can be divided into 2 types, positive and negative. These are not positive and negative like you might think. A positive symptom is not necessarily good, for example. In the case of schizophrenia and other psychological disorders, a positive symptom is one that adds a behavior, thought, or feeling, whereas a negative symptom takes away a behavior, thought, or feeling. In Hattie's case, the voices she hears are a positive symptom. They are something added that most normal people do not experience. On the other hand, her lack of emotion is a negative symptom. Feelings are a normal thing, and here they've been taken away. Let's look closer at both the positive and negative symptoms of schizophrenia.
So did you guys catch some of the symptoms that it talked about for negative and positive? So it kind of said, oh, go ahead.
Yeah, one of the other negative symptoms was the fact that she didn't care to make associations with people, friends, that kind of thing. And then I guess another one would be like the lack of hygiene and, just like she not taking care of herself.
Yeah, so you get the difference between the positive and the negative symptoms. Can you explain that?
Yeah, so the positive symptoms, like I said, is anything that's added. So anything that she is actively doing or feeling that's abnormal, whereas negative is anything that she should be doing and she's not.
Yeah, that's exactly right. That's perfect. So next we're going to go over what some of the symptoms are. And these are like 5 of the most common symptoms that come along with schizophrenia. The first 4, delusions, hallucinations, disorganized speech, disorganized behavior, those are all positive symptoms. And then I'll talk a little bit about some of the negative symptoms. So the first is delusions. And you guys have probably all heard of like someone saying that someone's delusional. Delusional, or a delusion, is something that's a false belief or an irrational belief that is unchangeable. So someone that has schizophrenia can have, there's kind of 5 different kinds of delusions. And the first one is persecution. So if you've heard of someone that is like a paranoid schizophrenic or someone that's very paranoid, they might have delusions of persecution. And they think that others are trying to harm them or spy on them or persecute them. The next kind of delusion is called a referential delusion. Has anyone here experienced a time where they saw like some kind of sign, or like they heard a song on the radio and they thought that song was playing at that time, specifically so they could hear it? That's happened to me plenty of times. I'm like, oh, that song was played and it was supposed to play right now. But that's kind of a delusion that schizophrenic people have as well, and it's not like we would have it normally, but it's more, it's like kind of stronger, and they would probably have it more often. So they would think that a sign, like a stop sign on the road, was meant specifically for them to see at that time in their life. And then the next kind of delusion is called grandiose. The schizophrenic person would have a false and irrational belief that they had some kind of power or knowledge that no one else had, or that they were super important, like the most important person in the world, kind of. And then there's a delusion called identity, which is where they would think that there's someone else. And schizophrenic people can have delusions that they're anyone. Anyone from history, like sometimes they have delusions that they might be like Jesus Christ, or that they're the Queen of England, anything like that. And then there's one called control, where someone with schizophrenia believes that they're not controlling their own thoughts, and that there's someone or some other force that is controlling their thoughts and actions for them. And so those are some different kinds of delusions. And like I said, a delusion is an irrational and unchangeable belief that someone with schizophrenia has. So even if they're presented with evidence contrary to their delusion, they might continue to still hold on to that belief. So the next common symptom is hallucinations. Hallucinations are like senses or perceptions that they feel or see. Hallucination can be sight, sound, and a lot of people don't know, but they can also be smell or taste. So someone with schizophrenia could smell something that's not really there, or taste something that's not really there. And they can hear voices. I don't know if any of you have seen Lord of the Rings, but every time I see the character Gollum in Lord of the Rings, it reminds me of schizophrenia, because he's always like talking to himself and telling him like all these things he's doing wrong and telling him like what to do. So that kind of reminds me of hallucinations and that kind of symptom of schizophrenia. This symptom is disorganized speech. So the person may have sentence structures that aren't formed normally, so they might jump from topic to topic. It'll be really incoherent. So they could be like, oh, I want to go to the store today. Oh, but the walls are white. I like my shoes. Like, they just like jump from one thing to another without really having any like real reason to switch. The next is disorganized behavior. So they may like move irrationally, or they may have emotional changes that are really sudden and unexpected. So you could be talking about something really sad, and they might laugh. Like they might laugh at something really sad. Like you could tell them their grandma just died, and they'd be like hysterical about it. And they could switch from that to being like really angry within like seconds. So it's really disorganized behavior that you wouldn't really expect. And they may like wear really like 7 layers of clothes on a really hot day. They just like do kinds of things that you wouldn't really expect someone normal to do. And then there's negative symptoms. So negative symptoms, like we talked about, are anything that takes away from their behavior. So there's negative symptoms that have to do with like social withdrawal. They can withdraw themselves socially from others, or they can have a lot of times have apathy or like a lack of enthusiasm or emotion for things. One symptom that I think is really interesting that's negative is called catatonia. And catatonia is where like they'll be stuck in a position and they'll like stay there all day. I had another teacher, I don't know if you guys know who Dr. Grifford is, but I took his abnormal psychology class and he told us about catatonic schizophrenia and someone that he had talked to who had a clinic that he worked at. And so this guy, he would stick his arms straight out, and this guy, he thought that he was holding the world in balance by by keeping his arms like this. So if he put his arms down, like the world would be in danger. So this guy, he would sit like this all day, every day, for hours on end. So Dr. Draper, he told me to get up, and he's like, hold your arms up as long as you can. I did it for like maybe 10 minutes, and I was like, I'm done. Like, I can't do that anymore. But the people who like have these symptoms, they think they need to do it. Like there's reasons in their mind why they need to do these kinds of things. And so that's some of the most common symptoms of schizophrenia. Does anyone have any questions about any of these symptoms? Yeah, go ahead.
Some of the symptoms you talked about kind of sounded like other mental disorders. You talked about hallucinations and Gollum and how he switches to me it kind of sounds like multiple personalities. You know, he's one personality and then he's another personality at the same time.
Yeah.
And then like disorganized behavior kind of sounds like bipolar. They're super happy and they're super sad. That's both emotions. I don't know, are they interrelated? Are they?
Well, it's really common for someone with one psychological disorder to have another, but also a lot of the symptoms related with one are also like some symptoms of another. So like anxiety can be really closely related to depression. It's just kind of like the way, like when you have a label, it can encompass a lot of things, but another label can also encompass a lot of things, if that makes sense. So like someone with multiple personality disorder, they could like have a lot of, I don't think that they really have hallucinations so much as like their personality is, like they have more than one personality. So like a hallucination is more like someone else, it's like, I don't, sorry, I don't know how to explain it. Dr. John, can you kind of explain it?
Yeah.
Well, I was going to say, is it like a beautiful mind where he sees people that think that they're real and he interacts with people that aren't really there?
Yeah, that can happen with schizophrenia. Yeah.
Hallucinations.
Yeah, so they can see someone that's not really there and talk to them. Yeah. But also there can be voices in their head that talk to them that aren't there either. So it can kind of, you can cross over.
Yeah, and the question is a good one because it's a real common misperception between the two disorders, especially what used to be called multiple personality disorder, and it's not anymore. It's now called dissociative identity disorder. Because everybody knew what multiple personality disorder was, so we had to change the name, so it kept it, it's not a secret. But a lot of people think, but especially when we talk about up front, Colton did a good job of talking about what the word schizophrenic means. And it's a split mind. And people say, well, isn't that a split personality? And then you have different personalities that actually take over. And that's a whole separate kind of a disorder where oftentimes the key being psychotic. And psychotic means there's a break with reality. And when you have somebody that has multiple personality disorder, they have a different personality that takes over, but they're still interacting with you in reality. It's still a reality-based kind of a disorder where they know who you are, they can interact in their job and whatever it might be. But somebody with schizophrenia, that's a psychotic disorder, and then they have this break with reality, and they're no longer with us in our reality anymore.
So, does that answer your question?
Yes.
Okay, perfect. Are there any other questions? So, next we're going to talk about a little bit about the causes of schizophrenia. The cause of schizophrenia is largely biological. So, we don't know the exact reason why it's caused, but we know that it's genetic. It can be transferred from like a parent to their child. So there have been studies done that have shown that if a child has one parent that has schizophrenia, then they have about a 13% chance of developing it later in their life. But if both parents have schizophrenia, the child has 50% chance to get schizophrenia. And twin studies that have been done are kind of similar. So they've shown that if one identical twin develops schizophrenia, the other identical twin has about a 50% chance as well to develop it. And if it's fraternal twins, then there's a 14% chance. And there have been studies done as well that kind of show that some of the symptoms related to schizophrenia are caused by excessive amounts of dopamine. There are drugs that are used to treat schizophrenia that kind of lower dopamine levels, but those drugs are mainly help with the positive symptoms of schizophrenia and not the negative symptoms. Schizophrenia isn't only biologically caused, though it's also caused partially by the environment. So there was another study that was done with adoptive children whose biological mothers had schizophrenia. And it showed that these children, the ones who were raised in a severely disturbed adoptive family, 11% of them that had biological mothers with schizophrenia got schizophrenia later in their lives, while 41% had severe psychological disorders. But the ones whose biological mothers had schizophrenia who were raised in a healthy psychological adoptive family, none of them developed schizophrenia. So there's a lot of environmental factors that play in there as well. So what I want to do now is if you guys could take out a piece of paper and if everyone could write down maybe some of the main things that we talked about so far. Just take a couple minutes, and then if I could have just a couple people talk about what they wrote down, that would be awesome.
One thing I wrote down was the positive and negative symptoms, how positive is an additional behavior, and negative symptoms are taking away from a behavior that would be normal.
Yeah, that's perfect. Anyone else? Go ahead.
Some of the positive symptoms are disorganized speech or behavior, delusional thoughts or actions, during voices or having hallucinations.
Right. Perfect. Does anyone have any other questions? We're gonna have a learning assessment or just like a little, like a short quiz about what we talked about. But before that, did you guys, were there any questions? Perfect. Well, thank you guys so much. I really appreciate your time. I'll just have Dr. John pass that out. If you could fill out the learning assessment and then do the evaluation, the teaching evaluation, and I'll have someone collect that. Thank you guys.